I want to tell you about a patient of mine named Mary. Mary was 64 years old, living just outside of Cleveland. When she first came to my office 3 years ago, she didn't walk in, she was wheeled in by her son. Mary was absolutely terrified. Her orthopedic surgeon had told her she had bone-on-bone arthritis in both knees. The cartilage was arguably gone. She was unable to stand long enough to cook dinner for her husband. She couldn't garden, which was the love of her life. She was facing immediate, double knee replacement surgery. She felt her life was effectively over, that she was about to become a burden on her children, destined for a nursing home before her time. But Mary had a fear greater than the pain. She was terrified of going under the knife and becoming dependent on heavy painkillers. She begged me, "Dr. Thompson, is there anything else I can do?" Fast forward to today. Mary is not in a nursing home. She isn't in a wheelchair. Last week, she sent me a photo of herself hiking a 3-mile trail with her grandchildren. No cane. No surgery. No pharmaceutical painkillers. How did she do it? She didn't use a miracle drug. She didn't use expensive injections. She used a specific, scientifically backed nutritional protocol that 97% of doctors completely overlook because we are trained to prescribe, not to nourish. Mary healed her body by giving it the raw materials it was starving for. And today, I am going to show you exactly how to do the same. But before we open the prescription pad of nature, I need to know who I am talking to today. I want you to pause this video for a split second. Go down to the comment section and type in your age and the one thing your knee pain is stopping you from doing. Is it 55, can't climb stairs? Is it 32, postpartum, knees hurt when standing? I ask this because I want you to understand that you are not alone. And more importantly, I want you to know that what you are feeling is likely not just bad genetics or getting old. It is usually a deficiency in specific nutrients that repair the rubbery shock absorbers in your knees. If we fix the deficiency, we fix the knee. For those of you who are new here, hello. I am Dr. David Thompson. I have been a practicing physician for over 30 years. I've worked in emergency rooms, geriatric wards, and private practice. I started this channel with a single mission: to help you live a life of independence and dignity. I want to keep you out of the operating room and off the long list of side effects that come with chronic medication. I believe in science. I believe in physiology. And after treating thousands of patients, I know for a fact that the body has an innate intelligence to heal, provided you stop poisoning it and start fueling it. Before we get to the foods, we need to confirm why your knees hurt. I want you to take a quick self-test with me. Hold up your hand. I'm going to list 5 specific symptoms. Put a finger down for each one you experience regularly. 1. Morning stiffness. You wake up and your knees feel like rusty hinges for the first 30 minutes. 2. The movie theater ache. If you sit for too long, your knees stiffen up and hurt when you try to stand. 3. Audible noise. You hear a clicking, popping, or grinding sound, we call this crepitus, when you walk. 4. Weather sensitivity. Your knees ache more when it rains or the temperature drops. 5. Puffy knees. You notice slight swelling around the joint at the end of the day. How many fingers do you have down? If you have 3 or more, type that number in the comments. If you have 3 or more, your root cause is almost certainly a combination of chronic inflammation and oxidative stress. Think of your knee cartilage like a smooth sponge. Right now, that sponge is dry, brittle, and essentially on fire at a microscopic level. The foods we are about to discuss are the water that puts out the fire and rehydrates the sponge. We are going to focus on 3 powerhouses today. I need you to incorporate these into your life, not just for a week, but as a lifestyle change. Solution number 1. The structure builder. The first food is something your grandmother probably made, but we've replaced it with processed stock cubes. I am talking about slow-simmered bone broth. Let me tell you about Mark, a 58-year-old accountant. Mark sat at a desk for 30 years. His knees were stiff, not from overuse, but from underuse and poor diet. He couldn't squat to pick up a dropped pen without wincing. Mark started drinking 1 large cup of this specific broth every morning. Within 4 weeks, the grinding noise in his knees reduced significantly. By week 8, he was taking the stairs to his 3rd-floor office. Why does this work? It's not magic, it's biochemistry. Your cartilage is made largely of type 2 collagen. Think of collagen like the steel rebar inside a concrete building. It gives the structure strength. When you simmer animal bones, beef or chicken, for 12 to 24 hours, you extract the collagen, which breaks down into gelatin and amino acids like glycine and proline. Now, here is the beautiful part. Glycine is an anti-inflammatory amino acid that acts like a reset switch for your cells. But more importantly, when you ingest this liquid collagen, your body breaks it down into peptides. These peptides travel to your joint tissue and stimulate your chondrocyte. Chondrocyte are the tiny cells responsible for building new cartilage. You are essentially sending a text message to your knee cells saying, "Wake up! Here are the bricks. Start building." A pivotal study published in Current Medical Research and Opinion, 2008, looked at athletes with activity-related joint pain. The study found that those supplementing with collagen hydrolysate, the active component in bone broth, experienced significant improvement in joint comfort and mobility compared to the placebo group. The science shows it actually accumulates in the cartilage tissue. Practical guide. So, how do you do this? You cannot use the boxed broth from the grocery store aisle that is mostly flavored salt water. The recipe: get beef knuckle bones or chicken feet, rich in collagen. Cover with water. Add a tablespoon of apple cider vinegar. This helps pull the minerals from the bone. Simmer for at least 12 hours, preferably 24. The dosage: 1 warm mug, 8 to 10 ounces, every single morning on an empty stomach. The secret combo: you must consume this with vitamin C. Vitamin C is the glue that holds collagen fibers together. Squeeze half a lemon into your broth, or eat a kiwi immediately after. Without vitamin C, the collagen cannot form properly. Have any of you tried making real bone broth before? It can be a process. Let me know in the comments if you prefer the taste of beef or chicken. Solution number 2. The inflammation extinguisher. Now that we are rebuilding the structure, we need to put out the fire. If your knee is inflamed, the enzymes will just eat up any new cartilage you build. This brings us to our second food, high-potency curcumin via turmeric paste. But, and listen carefully, using it wrong renders it useless. I treated a postpartum patient, Sarah, aged 34. After pregnancy, her ligaments were loose, and her knees were inflamed and swollen. She couldn't carry her baby up the stairs. NSAIDs, like ibuprofen, were upsetting her stomach. We put her on a golden paste protocol. In 10 days, the swelling reduced by half. She described the feeling as the heat leaving her knees. The active compound here is curcumin. Chronic knee pain is driven by a molecule in your body called NF-kappa B. Imagine NF-kappa B is a master switch in your house that turns on all the lights labeled pain and swelling. Curcumin is one of the most powerful natural inhibitors of NF-kappa B. It reaches into the cell nucleus and flips that switch to off. It stops the production of inflammatory cytokines, the messengers of pain. It works very similarly to drugs like Celebrex, but without the risk of heart attack or stomach ulcers. A systematic review published in the Journal of Medicinal Food analyzed randomized clinical trials and concluded that turmeric extracts are scientifically effective in treating symptoms of joint arthritis, with an efficacy similar to ibuprofen and diclofenac. Practical guide. Here is where everyone gets it wrong. Curcumin is poorly absorbed. If you just sprinkle turmeric powder on your salad, You absorb almost nothing. The how-to: you need to make golden paste. Mix turmeric powder with water and simmer it for 7 minutes to make a thick paste. The activator: you must add black pepper. Black pepper contains piperine, which increases curcumin absorption by 2000%. The carrier: you must mix it with a healthy fat, coconut oil or olive oil, because curcumin is fat-soluble. Dosage: take 1 teaspoon of this paste twice a day. Once in the morning, once at night. You can stir it into warm almond milk, golden milk. Be honest, does the taste of turmeric bother you? Some find it earthy. If you do, mixing it with a little raw honey makes it much more palatable. Solution number 3, the cartilage shield. We are building broth. We are soothing turmeric. Now, we need to protect. We need to stop the enzymatic destruction of the cartilage you have left. The third food is Brussels sprouts or broccoli. Specifically, we are looking for sulfur-rich cruciferous vegetables. Let's talk about Robert, a retired mechanic, age 70. His knees were constantly aching due to osteoarthritis. He felt like his knees were grinding away. After introducing a daily serving of sulfur-rich veggies for 3 months, his X-rays showed a slowing of degradation, and his functional mobility score improved drastically. This is fascinating science. These vegetables contain a compound called sulforaphane. In an arthritic knee, there is an enzyme called matrix metalloproteinase, MMP. I call these the Pac-Men of the knee. These enzymes literally chew up and digest your cartilage tissue. Sulforaphane acts as a shield. It blocks the enzymes that cause joint destruction. It effectively puts a muzzle on the Pac-Men. Furthermore, the high sulfur content is crucial because cartilage is rich in glycosaminoglycans, GAGs, which require sulfur to maintain their spongy, water-holding structure. No sulfur, no bounce. A landmark study from the University of East Anglia was the first to show that sulforaphane blocks the enzymes that cause joint destruction in osteoarthritis. They found it slows down the breakdown of cartilage in laboratory models. Practical guide. Cooking matters here. If you boil Brussels sprouts to death, you kill the enzyme, myrosinase, needed to create sulforaphane. The how-to: lightly steam them for 3 to 4 minutes so they are still crunchy. The hack: if you cook them, sprinkle a little mustard seed powder on them after cooking. Mustard seeds contain the live enzyme needed to activate the sulforaphane in your stomach. Dosage: 1 cup, at least 4 times a week. Dinner is a great time for this. I know Brussels sprouts have a bad reputation. If you absolutely hate them, regular broccoli or cabbage works too. Which one can you tolerate? Let me know below. So, my friends, here is your prescription for the next 30 days. This is your knee rescue protocol. 1. Morning, a cup of warm bone broth with a squeeze of lemon, the structure. 2. Evening, steamed Brussels sprouts or broccoli with mustard seed powder, the shield. 3. Twice daily, a teaspoon of golden paste with black pepper and oil, the fire extinguisher. Please, do not underestimate the power of these foods because they are simple. Sometimes, the most profound healing comes not from a complex chemical created in a lab, but from the grocery store. A gentle warning: this takes time. Cartilage has a slow blood supply, which is why it's white, not red. You will not feel a miracle overnight. But if you commit to this for 6 to 12 weeks, like Mary, Mark, and Sarah did, you will likely find yourself walking farther, standing taller, and living with less pain. I want you to try this. And I want you to come back in a month and tell me how you feel. If you found value in this video, please subscribe to the channel and hit that notification bell. My next video is going to cover the worst foods that are secretly dissolving your joints. Foods you probably eat every day for breakfast. You don't want to miss that. Until then, eat well, move often, and take care of your body. It's the only place you have to live. I'm Dr. Thompson. See you in the next video.